Here we are at Apollo Cancer Institute today. So we welcome you to AI Biz Healthy Life. It's very important and during the pandemic times, and we have an exclusive questionnaire where lots of anxious patients were interested to know more about the COVID versus the cancer treatment. The global COVID-19 pandemic has thrown up unprecedented challenges in every walk of life. The second wave of COVID-19 is playing havoc across the globe, and especially in South Asia and India. In this scenario, how a patient or a person hesitating to go to the hospital and get themselves diagnosed or checked. So let's find out all these answers, and we have our cancer specialist, Dr. P. Vijay Reddy sir, at Apollo Cancer Institute. All the viewers would be able to get their questions answered. So I welcome Dr. P. Vijay Reddy sir. Thank you very much for being on the show, sir. There are a lot of viewers who have their hesitations to go to the hospital. Would you advise them to not to hesitate and go ahead?
A very, very important question. We have life has to carry on. The pandemic is really creating havoc in the society. Simultaneously, we should know how to deal ourselves, how to deal with the problems that we are facing in and out. In a pandemic situation, how to take care of ourselves in case of any medical emergencies, medical issues, medical problems. So I am a cancer specialist. Let me deal with the symptoms and signs of cancer, how to deal yourself in a situation when you are having a suspicion of cancer or when you have symptoms of cancer, and what are the steps that you should take to go ahead with the treatment of cancer, and certain questions on vaccination. To start with, normally when you have medical issues, for let's say an example, you have a chest pain, you can't sit at home saying that COVID pandemic is around. You have to go to the hospital to take care of that immediate emergency that you are facing. Similarly, when you have symptoms which are suspicious of cancer, for example, you have change in the voice or an ulcer in the mouth, or you have bleeding from somewhere, or you have lumps which have developed which you have recently noticed, or you have discharge from any site. These kind of symptoms, or cough, a persistent cough, or a hoarseness of voice, could be anything which is somewhat related or gives you a suspicion that you have some issues, probably a cancer. You cannot stay at home. You should not stay at home. You should get investigated at the earliest point of time. All the cancer hospitals, all the institutions are taking special care in the pandemic situation, how to deal with the patients who are having suspicion of COVID, how to deal with the patients who have suspicion of other than COVID symptoms in all the hospitals. So if you have any kind of suspicion symptoms of cancer, you should certainly go to any of the cancer hospital at the early date, for the simple reason that you might diagnose a cancer at an early stage. With the fear of COVID, if you try to postpone to go to a hospital, then you land up in diagnosing a cancer at a very late stage, and that becomes incurable. So with the fear of COVID, you are making an early stage cancer into a late stage cancer. So never ever postpone. If you have any symptoms of cancer, please do attend cancer hospitals. Once you come to the cancer hospital and you get investigated, but unfortunately, if you suppose you are diagnosed of cancer, never hesitate to go for the treatment. Treatment of cancer is going on normally in all the cancer hospitals. For the last 1.5 years, the COVID pandemic is in place. We cannot wait for treating a cancer patient just because COVID is around. Cancer is not going to wait for till the COVID is has to go away. So please attend to your problems at the earliest. Get the investigations done. Again, all the hospitals are taking extra precautions to prevent these patients coming to the hospital to get infected with COVID. So the normal investigations which are required to diagnose a cancer need to be done at the earliest. For let us say an example, an endoscopy or a colonoscopy or a CT scan or a biopsy. So we have to go through those investigations and see if we have a suspicion of cancer to diagnose a cancer. Once you are diagnosed, the oncologist will tell you what could be the possible ways of going for the treatment. Now, the treatment mainly in cancer are surgery, chemotherapy, radiation therapy, immunotherapy, targeted therapy. So all kinds of treatment may require for any cancer patient based on the stage of the disease, site of the disease, and the diagnosis what you're going to make. For example, if you are planning to go for a surgery, the surgeon is advising your doctor is advising you to go for a surgery. Again, so for doing a surgery on cancer, you should never ever delay it. So all precautions are taken care. A COVID test is done before a surgery is planned, and once the surgery is done, you are discharged as any other normal individual. So the cancer surgery has to be, if it is indicated, has to be done at the right time without any hesitation. So once a cancer diagnosis, let us say the doctor would advise you to go for radiation treatment. So if you go to any cancer hospital, you see normally around 80 to 100 patients are on radiation treatment during this pandemic season as well. Again, the hospitals are taking all precautions to take care of these patients coming for radiation, who are coming normally for 2 to 6 weeks. Every day they come and get the radiation done. So never hesitate to go for radiation treatment if it is advised. Similarly, if you are advised to chemotherapy, you are expected to follow the advice of the doctor. I understand chemotherapy is going to reduce your immunity and you are prone to develop COVID infection more than the normal individual outside. That means you are more susceptible to develop COVID infection if you are undergoing chemotherapy. Nevertheless, if you do not go for chemotherapy also, there is immense risk of developing cancer or disease coming back. So you have to weigh between the pros and cons of the treatment which is required, which is immediately required, that is chemotherapy, and all the precautions which are required to go for chemotherapy to prevent COVID infection should be taken care of. The consultant oncologist would advise you and guide you how to do extra precautions to prevent yourself from getting infections. So wearing a proper mask and keeping yourself away from the people around you and keeping your surroundings neat and clean are of course mandatory. Normally, we try to maintain the blood counts so that the immunity does not stop or come down because of chemotherapy. So these are the simple precautions that we need to take, and even if you are undergoing chemotherapy, by chance if you get COVID infection, you will be treated as any other COVID patient, and we delay the chemotherapy cycle till you completely recover from the COVID infection. Normally COVID infection would take 10 days to 14 days to recover. After that we check the blood counts and then again we carry on with the chemotherapy as per schedule. So the main treatments of surgery, radiation, chemotherapy would certainly be continued as per the protocol, as per the schedule, as per the planned schedule of treatment, and then we taking special precautions to avoid COVID infection. Apart from that, you get immunotherapy and targeted therapy, or sometimes steroid therapy. So all these treatments can also go on simultaneously during this COVID pandemic without any hesitation, with reasonable precautions that we would have to take as any other person. So you can't be casual, you cannot be avoiding mask, you cannot be mingling with people when you are undergoing this cancer treatment. So those are the simple precautions. Anyway, you have to go ahead. Now, coming to vaccination, there are several questions that the people would ask as far as the vaccination is concerned. All patients who are undergoing cancer treatment are eligible for COVID vaccination. For example, if you are diagnosed of cancer and you are planning to go for any kind of cancer treatment, we would first finish off cancer vaccine, wait for 2 weeks, and then go ahead with the cancer treatment. It could be surgery, it could be radiation treatment, or it could be chemotherapy. In case if you develop infection during radiation treatment, you would be given 2 weeks rest before you get restarted with radiation treatment. Suppose if you get while undergoing chemotherapy, you will be given 2 weeks of quarantine time, allow you to recover from the COVID infection, and then we'll carry on with the chemotherapy. Now, when you want to get vaccination done during chemotherapy, any time between the chemotherapy cycles, you can go for vaccination. Only thing what we do is to check the blood counts and make sure the blood counts are normal before you get vaccinated. So during immunotherapy or targeted therapy, you can safely go for vaccination, and patients who have completed cancer treatment 2 weeks later, you can safely go for vaccination. Cancer patients who have been treated and who are cured of cancer and you are leading a normal life can also go for vaccination. So the cancer patients, attenders, family members can also go for vaccination without any hesitation. So vaccination is absolutely safe for the patients who are undergoing chemotherapy, radiation therapy, surgery, immunotherapy or targeted therapy.
Sir, you have covered most of the doubts about COVID and cancer. I have few more questions for you for your expert advice. Can we do vaccination on the day of chemotherapy?
That's a very important question. So normally on the day of chemotherapy, we would prefer to avoid vaccination. After giving chemotherapy, you need to wait for 2 weeks for the blood counts to become normal, and then you are permitted to go for vaccinations. So preferably 2 weeks after the day of chemotherapy.
If infected with COVID-19, cancer patients have higher chances of severe infection as compared to general population. What do you have to say?
You are partly right. So whenever you have any cancer patients on chemotherapy or radiotherapy and surgery, they are immunologically they are little compromised. So when they get COVID infection, they are expected to probably would have higher chance of developing severe infection. That does not mean every patient is going to have serious issues. We take care of these patients as any other COVID patient with an extra care, protect them from infections with prophylactic IV antibiotics.
For cancer patients, which vaccine is preferred?
Honestly, all the vaccines which are available are equally efficient and safe. So whether it is Covaxin or Covishield or Sputnik which is coming in the market or Pfizer vaccine, all these vaccines are absolutely safe in cancer patients.
What is the best time to get COVID-19 vaccine for cancer patients currently on active anti-cancer chemotherapy?
Normally we have to wait for 2 weeks after a cycle of chemotherapy to see that the blood counts become normal. Once the blood counts are normal, you are permitted to go for vaccination.
Cancer patients who have recovered from COVID-19, should they get vaccinated?
Yes, so patients normally when they are on cancer chemotherapy or cancer treatment, they might get COVID infection, and once they complete 14 days to 17 days after the COVID infection and they recover, they can wait for 2 weeks and then go for vaccination.
For cancer patient, given all the doses of COVID-19 vaccine, should there be any travel restrictions?
There are absolutely no need of any travel restrictions. Nevertheless, they should take care of themselves with all necessary precautions like wearing a mask and keeping a social distancing. But otherwise, they can travel wherever they want.
If a cancer patient already vaccinated for COVID-19 now develops COVID-19, should he or she be treated in the same manner as a non-cancer patient?
So patients who are already vaccinated and you get COVID infection, usually it is a mild form of infection. Nevertheless, you have to quarantine for 14 days and avoid cancer treatment like chemotherapy during these 14 days. Well, not only that, to protect yourself and also to protect others who get in contact with you, it's preferable to avoid any kind of treatment or stay at home or quarantine for 14 days.
Are there any contraindications for COVID-19 vaccination?
In general, there are no contraindications to go for vaccination unless and until a patient is allergic to the constituents that are ingredients that are there in the vaccine. That can be for any other individual, any individual that you might develop allergic reactions. For that reason, whenever a vaccine is given, you are made to wait for 15 minutes to half an hour to see that you have any kind of allergic reactions. Other than that, there are no contraindications for taking COVID vaccination, even for the cancer patients.
Can cancer patients receive whatever COVID-19 vaccine which is available?
Yes, so whatever is available, don't insist for any kind of vaccine. So whatever is available is absolutely fine. but nevertheless you should remember that the second dose has to be the same vaccine, that is the booster dose. Suppose you have taken Covishield as the first dose, preferable that you should go for a second dose of Covishield itself.
Is COVID-19 vaccine is less effective in cancer patients as compared to general population?
Theoretically, patients who are on chemotherapy, their immunity of the cancer patients is low, and immunogenic reaction to COVID vaccine probably could be low, but nevertheless, certainly any vaccine, even in a cancer patient, you would certainly have some kind of immunity which is better than nothing. So I would strongly suggest to go for vaccination even in cancer patients.
Is special monitoring required for COVID-19 vaccination in cancer patients?
Normally, no. So post-vaccination, as any other individual, even in cancer patients, you might feel rise in temperature, body pains for 2-3 days, and subsequently you will be as normal as ever. So you don't need to have any special monitoring required. And nevertheless, you will always get a blood count done when you are on, especially when the patient is on chemotherapy.
Can cancer survivors take vaccine?
Yes, cancer survivors are as normal as compared to any other individual in the society. They are normal individuals. They can go for vaccination.
Someone has just completed cancer treatment. Can they take the vaccine?
Yeah, so even the patient has completed a cancer treatment, for example, radiation treatment or surgery or chemotherapy, wait for 2 weeks and then you have to go for vaccination.
Someone has undergone surgery of cancer. Can they too take the vaccine?
So once a patient recovers from surgery, we normally allow them to wait for 2 weeks. Subsequent to that, they can certainly go for vaccination.
Someone on hormonal therapy for cancer, can they take the vaccine?
Patients who are on hormonal therapy, for example, in a breast cancer, patients are advised to go for an hormonal pills. So those patients can safely go for vaccination.
Someone has undergone bone marrow transplantation. Can they also take the vaccine?
So once a bone marrow transplant happens and you have a recovery phase, it could be 3 weeks to 6 weeks from post bone marrow transplant. The doctor would check your blood counts and bone marrow, and then once you recover from the bone marrow transplant, probably around 4 to 6 weeks, you can certainly go for vaccination.
Someone undergoing treatment for leukemia, the blood cancer, can they take the vaccine, sir?
Yeah, patients on leukemia, they are on aggressive chemotherapy, and the treating physician, the treating oncologist would check their blood counts quite frequently. Whenever the blood counts come back to normal, certainly you can go for vaccination under the guidance of the treating oncologist.
So we would like to thank you very much, Dr. P. Vijay Reddy, sir. Finally, I would like to request you important statement before we close this session.
So cancer is not going to wait till the COVID pandemic vanishes. So you have to take care of yourself. You have to take care of your health. Any issues, any health issues, do not postpone seeing a doctor, especially cancer. So when you have symptoms, early symptoms of cancer or suspicion of cancer, you should never ever postpone visiting a doctor. You have to take all precautions, wear a mask, keep social distancing, while traveling, while coming to the hospital. Hospitals are taking extra care to take care of the patients, non-COVID patients who are coming to the hospital. So get investigated at a proper time, and when diagnosed of cancer, do not postpone the treatment. So when you fortunately get diagnosed at an early stage, and whatever stage that you are diagnosed, the better that you get the treatment done. Under the specific precautions the hospitals are taking, the oncologists are taking care of these patients during this pandemic, whatever need to be done, we have to go ahead with the treatment. Do not postpone, do not hesitate, come forward and get treated, get cured and lead a normal life.